Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. If you feel... Good morning. Well, fine. And Dr. Mencia, I have so many questions about Alzheimer's that I want to talk to you about. And I know that as a practicing physician, I am sure that it's not that you've done a lot of research, because there are people doing this now, but the thing with you is that let's say you have patients, and you have you've been doing this for so long, you may have people you've seen for 25 years. All of a sudden, you must see a difference in them, or maybe you saw it. Sometimes people hide it. They know how to hide that their memory isn't there. So I want you to tell me, as a physician, what you think's happening with Alzheimer's, and what with your patients, what should they be doing?
Well, Alzheimer's.
Big subject,
beautiful subject. It's a beautiful subject. There are millions of people with Alzheimer's disease. And because of the baby boomers and the faster growing portion of the population is people in their 80s. That portion of the population is growing exponentially. Thank you so much. It's growing exponentially. So we have, as a society, we are not ready for Alzheimer's disease. And I tell you how unready we are, how unprepared we are. Alzheimer's disease today is like what we used to talk about schizophrenia in the 30s and 20s, in the 1930s and the 1920s. Well, to be schizophrenic, people will be locked up, killed, hidden. The family member will take the name out because they don't want people to know that there is a relationship of Mr. Smith and the son, Michael Smith, or John Smith has schizophrenia. And then the same thing happened later with bipolar disorder and depression. And then it became more acceptable to talk about these psychiatric conditions in the 70s and 80s. It became more acceptable because we saw the powerful and the rich people able to go and see a psychiatrist, and then that was a big plus. So with Alzheimer's disease, in reality, Dr. Alzheimer first came the world in 1907. So it's a little over 100 years that we know the diagnosis of Alzheimer's disease. Having said all of that, the big recognition in diagnosing Alzheimer's disease, recognizing the warning sign, because that's the key. Just like with schizophrenia and with depression and with bipolar, we tend not to recognize the warning sign because we were afraid to even talk about them.
Didn't we call it senile dementia before?
Senile dementia, say, you're just getting old. But the problem is you see people with Alzheimer's disease in their 40s. So people at a very young age, so the myth that to have Alzheimer's, you have to be in your 90s, late 90s, that's out the window.
Dr. Mencia, yesterday at the conference I went to at the Alzheimer's Community Care big conference, a woman whom I've known for many years, and I'm going to say her name because she and I are going to be able to do things. Dottie Carson came and spoke, and she's in her late 40s. She now has plaque, and they now have the scans that can tell her, and that she now knows that she has Alzheimer's, even though it's mild at the moment. But she can't do certain things in her whole family. Everyone's now jumping in, but she's happy that at least she knows it because she thought she was going crazy because she couldn't do this, she couldn't do that.
You cannot find a monster that you don't recognize.
Beautifully
said. If you
exactly.
know that you are developing something, if I know my prostate is giving me problem, I'm going to go and do research. And what can I do for my prostate? Well, the same thing with Alzheimer's disease. The earlier you know, and there is a condition that we use in geriatric medicine or now considered part of the DSM-4 in psychiatry is called mild cognitive impairment, MCI. So when a person have MCI, over 50% of the individual with mild cognitive impairment will develop Alzheimer. So if you know that you have mild cognitive impairment, but you don't proceed and get the PET scan, get the CAT scan, and we're going to be bringing. I tell you, Anita,
I'm sitting here amazed because you don't have to tell you. I would have to tell the audience. I had to tell the audience. When Dr. Mencia comes in, he always has his notes. He's always ready to talk, but he has a very busy week. And so I said, what are we talking about? He said, well, what do you want to talk about? I said, well, I just came out of this wonderful Alzheimer's conference. And I said, can we talk about it? I said, sure. And I'm sitting listening to this genius talk, and I'm saying, oh, I should have known. I am so appreciative, of your talking about this.
Thank you. And so with Alzheimer's disease, there are many warning signs. You can go into the Alzheimer's Association. They give you the 10 warning signs of Alzheimer's disease. And always on top is having problem with your memory loss, but the memory loss that disrupts daily living. Because we all can forget, what was that person's name? Or where did I put my keys? Or what happened to the shoes that I had on? And I used to go after my dog.
But if they're in the refrigerator, that's the problem.
Exactly.
It's not that you can't find them in the wrong closet, or you go in your car and you don't remember if you even had a car when you came. Right. That's when you're having those problems, right?
If you have your cup of coffee and you put it on top of your car and you drive away, that is no Alzheimer's disease. Right.
It's just you're too busy.
Right.
We know, don't
but
we,
if
Dr.
you take your cup of coffee and you put it in the glove compartment, then you're having a problem.
No, that's true. You're absolutely right. But there isn't enough information out here on this, and maybe at your center, we need to start helping people to get some of that for the mild cognitive. What would you tell someone that comes in and you see this happening?
That they have mild cognitive impairment?
And you can tell, even without testing, can't you?
Without testing, absolutely. Just by, a geriatrician, because we specialize in the disease, and a neurologist also, and some psychiatry that has some interest in Alzheimer's disease. Those are the three key specialists that we deal with Alzheimer's day in and day out. And we see all the stages of Alzheimer's. Just like an endocrinologist deal with diabetes, we are seeing, that's our specialty. So when we see the patient that have mild cognitive impairment, the first thing to do is to be proactive and to start doing all the vitamin testing, thyroid testing, everything that can exacerbate a quick decline. We work on those things. And because when you and I are sitting down here trying to educate the audience, talking about different diseases, and we always say prevention. For business, we say location. For longevity, prevention. So in order for us to prevent Alzheimer's disease, what do I do in my office? I don't care what is your age when you walk through my office. If you have insurance and you come in, when I do your blood test, I'm checking you all of your vitamins level.
Okay, stop a minute. Talk about me. Because didn't you do that with me? I went in, you had a full test, and you found out that I was very short, and I'm holding the little container now that's empty, that I'm going to get more vitamin D.
And I just stopped by the office to leave my dog there.
Right, okay. But vitamin D, I needed that, and also you're talking about my cholesterol. And I mean, those tests were fantastic. And so if someone comes into you, will you do all that testing for them?
Everybody, regardless of their age. So sometimes when I'm treating grandpa, daughter, and grandson, or granddaughter, regardless of which generation is coming, because as an internist, of course, I also treat younger individuals. So when they all walk in there, I'm not going to discriminate and say, okay, grandpa is going to get this test done, but the daughter is going to have that. No, everybody get everything done when it comes to prevention. I'm not going to do a colonoscopy on a 20-year-old girl, because unless it's really indicated, or a mammogram on a 20-year-old girl, because it's not really indicated unless there is a strong family history of breast cancer at a very young age, in the mid-20s, then that's the exception. So with Alzheimer's disease, we'll do the same thing. We go through all the prevention, and we are very aggressive, very proactive. Even in our home visits, you went to see that patient, Andy, that we went to see for the home visit. By the way, his mom always listened to me. She's listening to us. And when we went to see Andy, we did all of the testing that we would have done on him 40 years from now.
And you could do that in a home.
We do that in the home. We go and
home visits. Maybe I'm going to just stop
so,
you a minute, right?
Home
visits.
And I believe, Alzheimer's disease, if we want to, as a society, if we want to be proactive, because so much still to be learned. When you talk about the patient with MCI, mild cognitive impairment, we still don't know what is the best thing to do, what is the best cocktail to put those patients in. So yesterday we were talking with some investors about, let's do this longevity program. Let's talk about this longevity program. Let's find people to come and invest in longevity so that we can sit down, not only sit down and design a cocktail that is the right thing for me versus you.
Called personalized medicine.
Personalized medicine, where we can do the genetic testing. We can look at how things are being metabolized. For Alzheimer's disease, for example, right now, we don't have that many drugs out there. We have very few drugs, and 2 of them are the one most powerful use. For hypertension, we have like 25 drugs that we can use. And Alzheimer's disease is killing more people than hypertension. For heart disease, we have over 50 drugs that we can use. And Alzheimer's disease is killing more people than heart diseases. Who is getting the word out there? And the American Heart Association, I take my hat off, to them. They had done great fundraising, and people, get really worried when they come about their heart. But they don't worry so much about losing their mind. You know why? Because we think we can hide it. Yeah, and I see the patient when they come in and they forget what we discussed in the last appointment. When I ask them, like, did you have breakfast today or no? And they don't answer. They look at their companion to answer the question. Those are the key to me, that something is wrong with this person's memory, that they have forgotten if they have breakfast or not, how they got to my office today. Did they drop themselves or somebody dropped them in? Did they come, by car? Which car did they use? Et cetera, et cetera. So when I get those warning signs hitting me, then I start investigating to find out, is there anything going on? Because there is something called pseudo, meaning false, pseudo dementia. It's a false.
From medication. Right.
Over-medicating the patient. If your thyroid is out of whack, you can have a false Alzheimer or a false dementia. If you are depressed, a depressed person, you ask them a question, and they are so depressed they don't want to answer the question. It doesn't mean they have Alzheimer's disease. So we had to tweak out everything that can mimic the condition. And then when we get to the bottom, then we can detect if the person has Alzheimer's or not. Now, if one of your loved one, if yourself or your loved one had been hospitalized with some infection, and they told you that you really went crazy while you were at the hospital, that you were kicking and pushing, you were confused, you were calling your daughter, your wife, or your son, your husband, or what have you, you got so confused you couldn't even recognize your immediate family or your caregiver or your doctor. If you had been told that, that's called delirium. Delirium happened to a person with an infection. Any medical condition can go ahead, acute medical condition can produce a delirium in the brain, where the brain gets so confused and start firing like crazy. And those persons, then they get medicated to calm them down, and sometimes they almost put you into a coma so you can relax and they can treat your infection or whatever you have. And then when you are out of the hospital, you should be off from those medications, because that's a transient condition that is treatable when you treat the underlying condition, like an infection or whatever is, got you there. Having said that, if you have delirium, you should go ahead when you are in the optimal condition of your loved one. If it's grandma or grandpa, a person who had delirium, say, okay, let's go and get worked up at AGI for Alzheimer's disease.
You know, I want to say this to you, which is interesting. You should even mention that. I did take my mother to, there's in North Broward Hospital, there's a memory disorder center.
Yes,
I used to call it the memory center, not the memory disorder, because my mother didn't like that.
Yeah.
But they found out that she had Alzheimer's, Lewy body, and that was the hallucination that
Lewy
occurred.
body dementia.
Lewy body.
Yeah.
So, but this is, 20 years ago. So things are now moving very quickly. And what I like about you and your practice and your institute is that you're really on the cutting edge, Dr. Mencia, of bringing about now people who don't have Alzheimer's, but maybe have what you said, delirium because of trauma.
Exactly.
But then people who
Or
are
Alzheimer's.
early cognitive, and that you'll be able to now find the kinds of things in the clinical studies which are happening all the time to be able to help these people. And there are not that many places around. So let me give your phone number, because I think that you said the home, there's so many people. A lot of the people are not coming into your office. They're at home because, as you said, they're being hidden, or no one is taking care of that idea. So they're sitting at home now going to waste where you could be helping them. And since you do home visits, which I think is very important that we really dwell on that, that you could help those people. So let me give phone numbers. Dr. Mencia now has grown with his practice in his institute. He now not only has his commercial on the Commercial Boulevard office, which he's had for so many years, but he's now expanded to Boynton Beach. So either one, which is ever convenient to you, you can go to, and they'll make appointments so that you do get the best care. The phone number to call in Fort Lauderdale is 954-489-1345. And I'm going to repeat that. Get your pencils out. This is Pencil Talk Radio. You can't remember even if you don't have Alzheimer's.
That's right.
It's 954-489-1345. Now, the one in Boynton Beach is 561-270-6494. I'll repeat that again, 561-270-6494. And something that's really important for you to know is they are almost like a mini hospital in a way, but they don't treat you like hospitals. They treat you, it's all
like
personalized
home.
medicine.
Yes.
From their dental department to their ophthalmologist or the nephrologist or the neurologist or the cardiologist, or they have weight loss programs, they have a dietitian, they have a sleep apnea evaluation, they have a podiatrist. Just go there, and if you do nothing else but just get a tour, and you'll know what they do. And Dr. Mencia,
I had a it's interesting we decided to pick up this topic because not too long ago I had a lawyer, a young lady in her late 20s. I was giving a lecture at Capitol Grill, and she listened to the show after, so she might be listening to us. And she's been a lawyer, she's listening at the distance. And the topic attracted her because we were talking about geriatric medicine. And she approached me after the lecture. She said, I'm just here with a friend eating, but I was listening to you. And when I said, can I buy you a drink? I want to talk to you. And I said, no, it's okay. Just let's talk. So we sat down and we talked. And she said she, being a lawyer, a young lawyer with a very reputable firm in Broward County, she had her mother basically at home. Because her mother had basically lost it. That's how she put it. She lost it. She called me names, and she think I'm there to steal her money. And she said, what am I doing in her house? She want to kick me out of the house. And I don't want this to leave. If this thing go out, I wonder what will happen to my job. So I told her, we can go ahead and do a home visit on your mom. So he said, no, I can bring it to the office, but can I bring it where there's no people there? I said, no, we'll go to the house. So if you want to keep things hidden, we'll come to the house. There's nothing more hidden than that. So she didn't even want me to bring people to this. Say, no, we have to come with a nurse. I cannot come there by myself because I'm going to draw blood. And if you see her mom now, what a difference her mother makes today. Because went ahead, she was not being treated with medication, with the proper medication. On the contrary, she was on medication that were making matter worse. And she was just calling people to go ahead and call prescription in so that she can take it to the home and give it to the mom. And so I had to educate her that, hey, your mom is not a little dog that you have at home, or a parakeet. It's a human being. It's your mother who gave you birth. And if the firm that you work for cannot understand that you have a mother with Alzheimer's disease, then that's not your firm. You just got to find someplace else for you to work. But it wasn't even the firm. It was her.
Right.
She was just thinking the worst all the time, very negative attitude. I said, you have to change that. But we have taken care of the mom. Now the mother is able to come to the office and get seen. She see the ophthalmologist. Now she had glasses, because that's one of the things with a person with Alzheimer's disease. They get confused so easily. So imagine if you not have your eye checked for 5 years and you put on those glasses 5 years old, and you are looking at Ina with these glasses, and the person look like, is it a man or is it a woman? Is it my daughter or is my wife?
Good point. Good point.
So there are so many things. Then when we go to the house, every time I go to do a home visit, I check the light. I turn on the light. Because if I'm doing a home visit and I see that the house is kind of grim and the house is not well illuminated.
The blinds are down. It's dark.
It's dark.
And you're absolutely right, Dr.
And then they want to know why mom is falling so much. Is there a medication for her to stop falling? No, we have to go into the house and let's fix the house. It's a lot of physical thing. Alzheimer's disease is such an interesting condition and so easy to move forward. Like the lady you mentioned with the mild cognitive impairment, or just have the plaques. These are the times that you want to get your memory test and keep doing it at least every 6 months to every year to make sure that your memory is still, going strong. And do the kind of thing that are, that have proven to delay the Alzheimer's disease.
And to get involved in clinical trials, which are going like crazy here.
Right.
And so I have to plead with our audience, Dr. Mencia. I've been doing this a long time, and I know I have had a lot of loyal listeners who now Dr. Mencia has even so many more loyal listeners. If you have any questions, even if you don't want to go for a general checkup, you have to go and you have to let Dr. Mencia give you an evaluation, because he will have the right answers for you. You've just heard these stories. Alzheimer's now is kind of like where polio was many years ago. There's no vaccine, but they're working on it. Please, 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 if you're worried, go make an appointment. See Dr. Mencia. He will have a lot of answers. You may have Alzheimer's, you may not, you can never tell. But Dr. Mencia, I am so happy.
But we have all the cutting edge testing and things that are there for people to get checked. I
am so happy, because this is really probably the biggest disease now in the United States, even though we know more people die of heart disease. But this is the thing that the baby boomers are really going to be worrying about. And this conference that I went to shows that it's creeping up, and eventually.
And the bigger mistake for baby boomers is for them to be worrying about in the future. They have to worry about yesterday.
Exactly.
And today.
They have to worry and start getting
the
right
one
information.
Day behind.
They're one day behind. But Dr. Mencia, thank you very much. This was absolutely wonderful to talk about this. And Ina, thank you for coming.
Thank you for coming.
I know she's sitting here so quietly. She's our yeah. So thank you, and everybody, remember to go make the appointment. They're open on Saturdays. That's where he's running right now. I can never have breakfast with him. He has to run all the time to go. But it's 954-489-1345. Go and get yourself checked like I did. I feel so much better now. I know what I'm supposed to do. I'm losing weight. I'm eating more
You're
carefully.
taking your vitamin.
I'm taking my vitamin. It's been wonderful to have that with
And
you.
and it's important before we leave. The vitamin that we give patients, some of them, like your vitamin, is not for life.
Vitamin
It's just
D,
to
but-
bring up the level. Well, it's 5,000 units. It's not for life. We bring up the level, then we switch you to
You're
any.
switching me now?
No, after we check the level.
Oh, I
some
like
vita-
it. I
No,
like
it
it.
is
Sex
good.
is
It is
better.
very
I
good.
had to say something. We couldn't have a show without talking about sex.
Bye-bye.
Okay, thank you.
Bye-bye.
Bye.